Do facelifts look fake? I have seen facelifts that give away the fact that the patient had surgery. Sometimes the fakeness in the face begins before a facelift has ever been done. I find patients who come to see me and their cheeks are full of fillers, and they've been lost in this cycle where they have been avoiding to have facial rejuvenation properly. So they keep putting filler in their face by different injectors, and so their cheeks don't look realistic. I'm not really a big proponent of cheek implants. They make your anatomy less natural. Fat grafts can initially look fake, but over time fat grafts will end up looking very natural. I think when we fall into the pitfall of fake facelifts, it's when patients get trapped in a certain repetitive cycle. If you've had too much fat injections in the lips, that can look very abnormal. Scar tissue formation after surgery can do that. So that's why it's very important how and where and when you perform your first facelift. It matters how it's done, if it's done properly or if it's not done properly. And over time, what I find sometimes creates problems is when patients keep going back and they keep having another facelift and another facelift, and then we see problems that are visible to the eye of non-doctors, non-plastic surgeons, where you might see a face in a restaurant and think that looks fake. That's usually somebody who was trapped in this concept of wanting to keep looking better and better. So to avoid that, you need to be very careful about how many facial procedures you have. I've had many people who came to me for their third or fourth facelift, and when I found that their expectations were such that fixing those flaws would make them happier, I proceeded to help them, and generally we've succeeded very well with making people happy in their third or fourth revision. I do my best and I do the best work I possibly can, and they look amazing.